Welcome to Journey to Joy Live. I'm Dr. Joy, owner of Enjoy Life, living in full empowerment. Thanks for tuning in today. Today, I'm going to talk about ADHD. That stands for Attention Deficit Hyperactivity Disorder. In fact, ADD is no longer a thing. I know a lot of adults or kids or whoever, they don't have the H, the hyperactivity, but we still just say ADHD. So ADD, if you want to call it that, fine, but officially it's ADHD. So what do we know about ADHD? What do you know about ADHD? Typically, we think of like the child who's like bouncing around, can't stay still, interrupting people, can't focus on their work, can't maintain attention. That's usually the signs that you see. In fact, you usually might see it in boys more than girls, and that is because boys more so have those hyperactive symptoms that you can see, like, oh, he can't sit still. Oh, he's so hyperactive. He's just driven by a motor. He won't focus on his work. But girls sort of go unnoticed because they more so have the inattentive symptoms. Like if a child is supposed to be focusing, but they're just kind of like staring off and looking out the window and they're quiet, right? They're not the ones that are disruptive. So it could go unnoticed that they actually have ADHD because it's more so that quiet, inattentive ADHD. So there are three types. There's the inattentive ADHD, there's a hyperactive ADHD, and the hyperactive combined with impulsivity. And then there's the combined ADHD. So it's combined with inattention and the hyperactive and impulsive ADHD. So when you think of the inattentiveness, it's pretty much what I've just been saying as far as not being able to focus, easily distracted, anything that requires their ongoing attention, like doing homework, they just can't sit for long periods of time. Also includes being disorganized as well, losing things, being forgetful. You know, some people might say, well, they can focus on the video game. They sit there for hours at a time. So I don't think it's ADHD. Well, they're interested in playing the video games. So of course, they're able to pay attention to that because it keeps their attention and it stimulates them. So they're always looking for things that are new and the things that are exciting that can keep their attention. Math homework is not keeping their attention. Reading that boring book. Yeah, it's boring. School is boring. And that's what I tell my patients. Oh, school is boring. It's supposed to be boring. Is it supposed to be exciting? Sometimes it's exciting, but that's okay that it's boring. Anyhow, going on that tangent. Yeah, if it's boring, it's likely not to maintain their attention. If it's exciting, like video games or playing football or whatever, they do better at that. So that's the thing. If they have ADHD and they have lack of focus in school, it doesn't mean they're going to also have that lack of focus during that fun activity because that activity is fun. As far as hyperactive parts of ADHD, that's that driven by a motor, can't sit still that I mentioned, interrupting people, can't wait for the teacher to finish asking a question. So they're just hyperactive and you're just like, could you sit still? Why can't you sit still? And then impulsive is, doing things without thinking. Sometimes I put lying in that category. And I know a lot of parents, they are concerned about their kiddos lying and doing things without thinking and taking things. They call it stealing. I say taking things. I mean, if you're taking something from your mom, it's like, okay, do we have to use that strong word steal? But anyhow, sometimes I put lying in the impulsive category because obviously it's something that they're doing without thinking. For the most part, I don't think a medication is going to treat lying, but it could be a symptom of ADHD. Things that you're doing without thinking. Playing with their kid sibling, grabbing them and hurting them by mistake or something like that. Sometimes you might see some increased irritability it's a part of the impulsive side of ADHD. So you definitely might see the irritability, getting mad easily and things like that. ADHD, typically you want to say you've seen the symptoms before the age of 12. So when it comes to like a 16-year-old coming in, you want to say, well, yeah, little Johnny had symptoms ever since like I can remember. It's not that it started at 16. Of course, that goes into like that conversation of adult ADHD. Did you have it as a kid? You want to know that the symptoms were before the age of 12, that you did have them as a child. It used to be before the age of 7, but people were forgetting. They can't remember that they had symptoms before the age of 7, so it kind of moved it to the age of 12. Okay, I digress. As far as the symptoms, you want to see them having the symptoms for at least before the age of 12 and also at least 6 months. And the symptoms need to interfere with their development or interfere with their functioning, right? So, I mean, you might have a distracted kid, impulsive kid, hyperactive kid, but they're getting all A's. So it's like, okay, well, maybe I got some ADHD symptoms, but it's not affecting anything. So maybe you don't have to do anything about it. That's good. But when it comes to needing to treat it, it also doesn't mean that you have to treat it with medication. There's therapeutic techniques, behavioral therapy. There's special accommodations that you can have at school, like the 504 accommodation. I mentioned that last week. So the doctor can fill out the 504 form. It's a medical form that's filled out by the doctor and can say whatever special accommodations. They need to sit up front of the class so that they're not distracted, sit away from the window, sit away from the door, sit away from others so that they're not distracting others or disturbing others, having more time on tests, having an extended deadline so that they can have more time to get their assignments in. Various ways, different accommodations that you account for. If the 504 doesn't work, you could do an individualized education plan. That's the IEP, and the school will have to do a educational evaluation, psychoeducational evaluation. And then that can determine what we're doing with the IEP and what particular accommodations are made. So that's more strict and more in depth. You get a full report of what kinds of accommodations. As far as diagnosing ADHD, it's not just, oh yeah, let's check off those symptoms. The most common forms that we use are the Conners assessment as well as the Vanderbilt assessment. And it has to be diagnosing the symptoms in two different settings. I give the forms to the parent to fill out so we can look at the home setting. Do they have the symptoms at home? And then I give this evaluation to the teachers. Is it happening at school? Usually those are the most common two settings that a kid is at home, a kid is at school. Sure, a doctor's office can be considered a setting, being at Walmart, different settings in their life. But for the most part, why not? They're at school, they're at home. Let's get the parent to fill out how are they acting at home? How are they acting at school? If they're only acting this particular way at school, but not at home, they're completely fine. They're able to do their homework. Then it's kind of a wonder, well, what's happening at school? Is there something else going on? Is it a learning disability? Are they being bullied? Are they anxious? What's going on just at school? Or what if it's the opposite, where they have ADHD symptoms only at home, but the teachers are like, oh no, they're completely fine. They don't act like this at all. So it's just like, well, what's going on at home? Is there a lot of stress at home? Are they moving around a lot? Homelessness, financial issues, abuse? Is there something going on at home where they just can't focus? Is there something else? And if you watched my teaser yesterday, then I said, is it ADHD or is it something else? Because just because someone is distracted, can't focus, hyperactive, it doesn't mean it's definitely ADHD. Sure, it could be ADHD and something else, but what if it's not ADHD and it's that something else? What is the something else it could be? Could be a mood disorder. Anxiety can make someone anxious and nervous and can't sit still. Depression can make you lose concentration, getting distracted easily, not being able to focus and attentive, right? If you're depressed, you're constantly thinking about something else, right? It could be some type of trauma that you've experienced. If you've been traumatized and you're anxious and experiencing symptoms of post-traumatic stress disorder, you're not focused. You're trying to think of, how can I survive? How can I avoid whatever this trauma is? How can I avoid thinking about this? So of course that looks like ADHD. Is it a substance abuse? Hopefully for that small child, it's not a substance abuse. If you're talking about a teenager or an adult, is it a substance that's leading to these types of symptoms? Like I said, anxiety can do that. Smoking can do that. Smoking weed can do that, right? So make you have slow processing and not being able to focus, not being able to concentrate. Is it a learning disability? I always ask the question when they're trying to do their work, once they're able to focus, do they still not understand? If they actually can focus and read it, Are they not comprehending it? Is there a reading learning disability? That math, are they just not understanding the math? Once they actually are able to focus, once they can get beyond okay, I can maintain my attention now, but I still don't understand it. So is it ADHD and a learning disability, or is it not ADHD, but it's just a learning disability? A lot of people ask about ADHD in adult. Well, do I have it? I'm an adult. Ask yourself, thinking back, did you actually have it as a kid? Did you have like issues with attention? Well, no, I had all A's and things like that, but now I just can't concentrate. That's my story. I had all A's in high school. I was pre-med, I was set, I was good. And then when I got to undergrad, everything just got harder. And so it was just harder for me to be able to maintain my grades. And then I went to med school and I created this great study schedule of how to stay organized. I put everything in charts because I knew that charts is what helps me. So I started to do better. Graduated medical school, great. But in residency, I lost that organization of putting everything in charts and remembering everything. It just got harder to study, and I was just learning on the job. That's pretty much what you do. You learn as you go. You learn as you see patients. But then I started joking like, oh, it's my ADD. It's my ADD. And someone finally walked up to me. They're like, you joke a lot about your ADD. Do you want to get that checked? And I was like, oh, do I actually have ADHD? So I went to see a psychiatrist and he diagnosed me with ADHD and gave me a medication. I started Vyvanse. That is a stimulant. That was back in 2016, 2015. And I started to do better. I was like, oh, I'm actually able to maintain attention. But then I decided for myself, do I really want to be on a medication? I had some other things going on. Maybe I'll disclose that stuff in another Journey to Joy. But for now, I had some other stuff going on. And that made me need to get off the medication. And when I got off, of course, I still had ADHD symptoms. So I found that fish oil helps. It's a natural supplement, omega-3 fatty acids that you can take as a supplement for ADHD. For some people who really need to be on a medication, I wouldn't say it's a replacement. But for some people, why not start with the fish oil? Because maybe you don't need medication. I am one of those folks where I am able to maintain treatment for my ADHD on just fish oil alone. And that's about 2,400 milligrams a day, at least. So you're going a little bit beyond what it says to take on the bottle. For those who want to go the natural route, fish oil can definitely help. And of course, I talked about behavioral therapy can help and the special accommodations at school or the special accommodations for you as an adult. Obviously, you're not at school. You're not getting those special accommodations like the 504 plan or the IEP, but you're doing things like making sure you have an agenda, making sure you're writing everything down, doing those things to make sure you're organizing yourself, organizing your life, having a watch to be able to keep track of whatever it is you have to do or keep track of your schedule. If you're someone that loses things a lot, being able to have your area clean so that limits what you're losing. Obviously, a cluttered area is a cluttered mind. So there's plenty of ADHD books out there. I don't have them to list them, but there's plenty out there. I'm not good at that. My therapist friends are really good at shouting out what therapy books there are as far as for ADHD. I'm going to shout out Jessica B. Taylor. She's good at that. But anyhow, where was I going? Look at me. I'm all over the place. I just disclosed that I have ADHD, but that's okay, right? It's okay to be all over the place. So I was talking about ways to treat ADHD outside of medication. In other words, what I'm trying to say is you don't necessarily have to treat with medication if your child has ADHD or if you have ADHD. What if you have to? What if you tried all the behavioral therapies, individual therapy, fish oil supplements, you tried to change the diet? I don't go into a lot of research on that. A lot of people ask me what to do as far as diet. Sure, you can limit carbs, limit the sugary drinks and sugary foods and candies. You can try that out for yourself and let me know if it works. I'm not against it and I'm not for it, right? So that's the stance I take on that. But a lot of people say that maybe that you could change the diet to help. So you changed all the diets, you changed all that. You got them in sports to kind of get them more organized, because sometimes getting them in sports gets them more organized because between school and sports, they have nothing else to do but study. It's like, study because you got to do this. Sometimes that helps. What if you need a medication? Stimulants are the most common medications. They're not the only ones. There's stimulants like Adderall, Ritalin, Concerta, Focalin, and then there's non-stimulants. There's alpha agonists. Those are clonidine and guanfacine that pretty much treat the hyperactive symptoms of ADHD. And then there's the non-stimulants that are the atypical antidepressants like Wellbutrin, Strattera, and Quellbri. So as far as the stimulants, I mean, outside of antidepressants, they're the most common meds that I do prescribe. It doesn't mean that that's the first thing that I jump to. I really rather we try those non-medication techniques first before starting a medication. At the end of the day, they're well tolerated. If you put them on a stimulant and they're not eating, there comes the concern for a small child, is it going to stunt their growth? The poor nutrition, is it going to make it so that they're not going to grow and meet their potential height that they're supposed to meet? That's when I start collaborating with the primary care doctor, because they obviously track the growth. Are they falling off the curve all of a sudden? If they come from one line to the next line, then we know, could be stunting their growth. ADHD medications are FDA approved for kids down to age of 6. Yeah, I believe it's 6, not 3. I don't know why 3 is coming to mind. But anyway, I look up this stuff every time I prescribe medication. It's too much knowledge up here to remember every single thing. But anyhow, it's FDA approved at a very young age. Just because it's FDA approved, I really don't like giving kids younger than 6 the stimulants because of that issue. I would usually start with a guanfacine or a clonidine. So that's that alpha agonist. Those medications are the high blood pressure medications. They're used to lower blood pressure, but somehow decades ago, they found out that it can treat the hyperactive ADHD. So it does tend to help with the younger kids. And it's younger kids that usually have the hyperactivity. As kids age and go higher, usually by the time you're an adult, the hyperactive ADHD goes away, but that inattentiveness maintains. So if you have ADHD into adulthood, it starts to look more like inattentiveness. And a lot of kiddos, their inattentiveness and their hyperactivity goes away, the ADHD goes away, and they don't need treatment. So not everybody who gets started on a medication needs to stay on a medication for the rest of your life. In fact, it's recommended to try to get off of it and see what you can do to use therapeutic techniques for your ADHD rather than relying on that medication your whole life. The conversations I have with the parents of my patients is, definitely letting them know about the loss of appetite that can happen with stimulants. Usually, if you start out with the medication, a short-acting medication where they take it after breakfast, that wears off by lunch, and then they take it again after lunch, they got in their food, they got in their breakfast, they got in their lunch, and then it wears off so they can have the dinner. So as you can see, there are 2 formulations of stimulants. You can have a short-acting, like I said, you take twice a day, or a long-acting, where you take it again after breakfast. You want to take it after breakfast, lasts all day. So pretty much it releases a little bit amount of the medication in the morning that works for the morning. And then there's like a slower release portion of the extended release that goes throughout the day. There's some that last 8 hours. There's some that last 16 hours. I think it's Medeus. It's supposed to last 16 hours. So there's different kinds of medications where it releases 50% of the medication in the beginning, and then it releases the other 50% throughout the day. And then there's some that's like releases 30% and releases 70% throughout the day. There's different ones. There's 2 categories of stimulants. There's an amphetamine category with Adderall, Vyvanse. And then there's the other one, the methylphenidate category. That's the Focalins, Concertas, Ritalin LA, and different things like that. What makes me choose one or the other? It's like, I've started people with the methylphenidate category. I've started people with the amphetamine category. There's no real, unless someone says, oh, he tried Concerta and it made him like a zombie. Then I'm like, okay, well, let's start with the Adderall category. When they work, they work. And you don't have to take them every day. It's not one of those that have to build up in your system. When you want to take it and you need it, you take it. And when you don't want it, you don't take it. A lot of parents don't give it on the weekends or during holidays. A lot of parents do give it on the weekends and the holidays because they're just like, yeah, these symptoms are 7 days a week, so I'm going to give it 7 days a week throughout the year. And that is just fine. So common side effects, I mentioned loss of appetite. There's also the issues with it keeping you awake at night if you take it too late in the day. For the most part, it wears off and it doesn't, but that is a side effect. You can't take it at night. You have to take it earlier in the day. If you're on it twice a day, I usually say don't take it after 1 p.m., 2 p.m. at the latest, or else it'll affect the kiddo's sleep. As far as the atypical antidepressants, I mentioned Quellbri, Strattera, and Wellbutrin. Wellbutrin is also FDA approved for depression in addition to ADHD, as well as smoking cessation. I'm not usually talking about smoking cessation with my kids, but Wellbutrin is a good medication that you can add to a stimulant or that you can have by itself, especially if you also have depression. Strattera is good if you also have anxiety. Sometimes Wellbutrin can increase the risk, not increase the risk, but increase your anxiety. But that's just in 10% patients. So just because you have anxiety doesn't mean you can't be on Wellbutrin. Quellbri's new. I'm still trying to figure out if that's working. I have a few patients on it. I'm sure they'll let me know. I think it's working. Anyhow, so there's so many different stimulants. But, don't be afraid of them. Yeah, there's the side effects, but there's some workaround with that. Some kiddos who have the loss of appetite, the medication works so well for them. Their grades just shot up and they did so well. And for whatever reason, they just can't eat while on the medication. You can be on another medication called cyproheptadine that helps increase the appetite. Of course, we're still working with the primary care physician about that. If it works, it works. And that's usually a conversation with the parent, whether we're going to add a whole nother medication versus trying another one. But usually parents have been trying to get their kiddo treatment for ADHD for so long, and they're just like, I don't want to touch it. It's working. So if you can give them an appetite stimulant, I'll do it. But you don't always have to do that. That's the way I go. I say start with therapy, start with the behavior modifications, alternatives, and then if we need to go to a stimulant, we go to a stimulant. Some parents want to try that right away. Again, that's okay. It's a conversation between myself as a doctor and the parents. I don't tell people what to do. I try to have a good conversation with what they would like to do. Let's see, what other questions have I had? So adult ADHD, of course, with the kids, I do a thorough assessment always. Definitely with the adults. I don't want you coming to me trying to just get Adderall. I need to know you really do have ADHD. And you want that too. Care about your brain. Love your brain. Especially as an adult, there's dependency. These stimulants are controlled to substances. You can get dependent on them. Tolerance can happen. I check in with my adult patients all the time. Like, okay, let's try this trial off of it. Let's see, do you still need the stimulant? Or I've had conversations, you don't have no job anymore. You're not in school. Why are you still on the stimulant? Oh, I can't concentrate. On what? What are you concentrated on? I'm sorry. It's like if you need to do without the medication, you want to try without it. Well, let's try without it. Why are you relying on this medication? If you have a history of addiction, it doesn't always mean you can't be on a stimulant. So that's a whole nother conversation. Next month is recovery month. How about I circle back on that? Next month. Next month is also suicide prevention awareness month. There's a lot to talk about in September. So, with that said, though, with adult ADHD, I want to make sure, is it not also anxiety? Is it not also depression or some type of mood disorder that's making it come out? Going back to myself, residency was really, really stressful. So I know I suffered from some anxiety and residency that pretty much brought that out. Also, thinking back when I was in high school, when I was in middle school, I daydreamed a lot. I was that inattentive girl that went under the radar, even though I did get the grades, right? I got the grades, but it went under the radar. So no teacher was just like, oh, little Nina is not paying attention. She's distracting others. She's disturbing others. But I would just enter into like a whole daydream world and just like think and think and think and think, oh, I'm in this fantasy world. And then I'm like, oh, shoot, I'm not paying attention. ADHD. So with me, although it wasn't noticed, it was there. It was there before the age of 12. So it wasn't like this new onset adult ADHD. So yeah, I don't know how I feel about new onset. To me, I feel like there's something else going on. The anxiety, let's treat it. The depression, let's treat it. Let's treat your substance use disorder. Is it bipolar? Is it schizophrenia? Are you distracted because you're hallucinating? Yeah, that could be a thing, right? Let's treat your schizophrenia. Like I said, it can be comorbid depression and ADHD. You can have comorbid anxiety and ADHD. But even then, I like to treat the mood disorder first. Let's treat the anxiety first. Because what if once we treat the anxiety, your ADHD is just fine and you can live with it using just the behavioral modifications? Rarely is it the other way around where I treat the ADHD symptoms first and then worry about the mood disorder. There are some kids that are on a stimulant, and I have therapy treating their depression. So I guess that's those cases. But for the most part, especially with adults, I'm treating your mood disorder first. I'm not going to give you a stimulant. We're going to send you therapy. You're going to talk about that mood. And if you need an antidepressant, you're going to get on the antidepressant. But you're most likely not going to get on a stimulant first if you come to me. All right. So that's ADHD. Send me your questions. Post a question in the comments. Send me a question in the message. I only plan on talking about ADHD today because next week, Thursday, August 31st falls on Thursday. And August 31st is International Overdose Awareness Day. So I'm going to be talking about overdose. Like I said, September is Suicide Prevention Month. I've spent a lot of time talking about that. It's also Recovery Month. We'll slip that in and I'll have some guests, hopefully. That's it. I hope you learned a lot about ADHD. Thank you for watching A Journey to Joy Live.